Good morning, good afternoon, good evening, whatever time of day it is that you are listening today or watching from wherever you're watching from. My name is Linda Hayles. I'm a high performance coach for high level female entrepreneurs. And today I'm being joined by Dr. Leah Antoniewicz. Did I
Good.
say it right?
Yeah, you nailed it.
Dr. Leah. And I also saw you online as Dr. Leah A to Z. I thought that was so cool. The first and last letters of your last name. I love that. Like that literally needs to be your website, Dr. Leah A to Z. Like that's so cool. Um, and Dr. Leah, I'm going to let her introduce herself, but I'll tell you a little bit about how I met her. I had been suffering with symptoms for years that literally, no joke, like I know I joke a lot and you guys hear me say a lot of things, but this is no joke. I literally thought I was dying for 2 years because I couldn't understand what was going on with my body, the body aches, the stiffness, all of the symptoms. And I was one of those people who was very scared of hormones because of what my mom had told me and everyone else. And even though plenty of my own clients and my best friend would tell me, you need to go to these doctors, you need to get these pellets. My friend is on these pellets. Her life has changed. And I was like, so scared. But you know what they say? Where there isn't enough pain, there won't be any change. And so when I was at my wit's end and I couldn't take it anymore, I decided to do some research and literally I found Dr. Leah through a YouTube video. She doesn't know this. She was local and I told her this the last time I saw her. I chose her because she had dark hair and she had a name that wasn't fully American. And I thought, I really want to trust a woman like me who is ethnic and who is a professional. And so I decided to go to her practice. So, Dr. Leah, welcome to the podcast and introduce yourself. Let us know who you are and why you came to be who you are today.
Thank you so much. It's just been a pleasure getting to know you, and thank you for that introduction. I basically, we talked, Linda. I was a board certified OBGYN, and I was in academic medicine for about 20 years, meaning that I was at institutions like the University of Texas and Baylor, and I taught residents and medical students and all of those things, and really, really loved it. But since the entire time I've been in medicine, I always saw this gap in what traditional medicine doctors do. And basically, we kind of try to change or block an enzyme or a process instead of really looking at the root cause oftentimes. And that is something that like a functional medicine doctor would do. I usually give patients the analogy that a functional medicine doctor, if you had a splinter in your finger, would remove it, and a traditional medicine doctor would give you an aspirin. So I am now an integrative doctor. I do both. And so I've studied to do that. But what really changed things for me was, several years ago now, taking care of women or not being able to take care of women who were coming in and having miscarriages and things like that, and being limited on what I could do for them, and seeing them almost die and go to the ICU and things like that because of political decisions being made by people who aren't medically qualified. Also, our legal climate. And then thirdly, I started going through perimenopause. And before that, I saw my own OBGYN colleagues suffering. And I was just like, I'm not doing that. Like, I mean, they were miserable and exhausted and all of these things. And some of them were even on hormone replacement. So I started doing research, and going through this myself, still in perimenopause, I started doing research, and like you said, I suffered enough in the traditional system, and so to speak, I call that suffering and not being able to take care of people the way I wanted to take care of them. So all those things kind of came together, and I made the jump.
And you made the jump. What and I know I heard you clearly explain. I made the jump to this type of healthcare because of some of the decisions that have been made, and some of these things are no longer covered by insurance because of the
Mm-hmm.
legal decisions that have been made. And because some people would be like, I've already told people, some people, like what it costs for me to go there to a concierge private practice. And they're like, well, Linda, that's expensive. And I'm like, it's not even covered by your insurance anyway. Am I
So
correct?
absolutely. So I can't even bill for a menopause visit. Like insurance just doesn't cover it. Several of our therapies, certainly testosterone, which we can talk about. Testosterone, you have 10 times more testosterone than you have estrogen in your body. And yet replacing this is somehow deemed I don't know, not important for women. I mean, it's just crazy. It's also crazy because there's people making decisions that, haven't gone through this. We'll just leave it at that. But even
Exactly.
the science aside, right, they have not had to go through it. So decisions are being made for women, not by women that have experienced these things. And I don't know how to say this. Is really not sarcasm. It's the truth. But, we just aren't studied unless we're using our womb. And so there's that. So there's several limitations and problems with being able to deliver the kind of medicine that women in midlife and beyond truly, truly need.
Oh my God, Dr. Leah, I was telling you backstage before we started the recording that I didn't know I would get older and I would have these feministic views. I would be a feminist. And you were like, but let me tell you what feminist really means. And so when I think back to my, my younger years, even in my 20s, when I was giving birth, when I was, having my family, I was like, I'm not, and God forgive me, this is my opinion. It doesn't reflect the opinion of every woman, but like, I'm not going to a man doctor. He doesn't have ovaries. He's never given birth. And I don't care if he went to school to learn how to deliver a baby. Like, he cannot possibly know what cramps feel like, or what this right here is feeling like, or when I'm explaining this. And I'm not saying that if I would have had to gone to a specialist and the only specialist available was a man, that I would not have gone. I'm just saying that I prefer a woman who she thinks like me, she feels like me, she understands my plight. So thank you so much for saying that. Let's just jump right into this menopause talk, because it is taboo. I was one of those women who it's not that I didn't know what I didn't know. I also didn't know what I did know. And I was so scared. The whole fear mongering, the basic biggest thing that women hear: you're gonna get breast cancer if you get these hormones replaced. And tell us about that. Tell us about that, please.
So I'll start off by saying that the human brain has a very protective kind of ancient part. It's called the amygdala, and it is meant to protect us. And so it is, we'll just say 10 times more powerful than your prefrontal cortex, which is your logic part. And when I say 10 times, that don't quote me on that, but we hear something and we know what we don't want. We're always trying to protect ourselves. And so even if we hear something and that's not true, and it's been perpetuated for 20 years and it's not true, it's really hard to undo that. The toothpaste is out of the tube. So over 20 years ago, there was a study done that it was the largest study, most expensive study, on women and hormone therapy. And there were several flaws with it. And basically, there was a small increased risk in breast cancer for women who were on both the conjugated equine estrogens, meaning they got estrogens from horse urine, and it was combined with a synthetic progestin, meaning that it was not body identical to the progesterone that you make. And this was combined in an oral pill. And I can assure you that I will never prescribe that for you. And truly, people really shouldn't probably be on that because there's much safer alternatives. All of that being said, wrong drug, wrong route, and wrong patient population. They studied women who were already, on average, far outside of menopause, had heart attacks, diabetes, obese, smokers. I mean, they had all of these health problems at baseline. They weren't like you and me. And I could go on about that, but that has kind of been perpetuated, and it's still perpetuated by doctors in my specialty. What was not reported by Time magazine, who got a headline out of it, hormones cause breast cancer, because boy, that sells some magazines now, doesn't it? Which it's been retracted and all of those things. But They didn't talk about the fact that women who were on estrogen only, even though they were horse estrogens, didn't get breast cancer. And then the women who didn't have an increased risk in breast cancer was even protective, and that there was a protection against colon cancer and other things that was protective of. But in even the women that were on that combination estrogen and progestin fared far better if they did get breast cancer than their counterparts. So none of those benefits were publicized, just the scary one, right? The thing that sells magazines. So today, in my practice, we use bioidentical or body identical, meaning it's the same chemical structure, hormones. Some are prescription, FDA approved that you can get at your pharmacy. Some are compounded, which are natural and plant-based as well. There's a wide range. There's a wide variety of things for you to choose from, depending on your values, your lifestyle, and we can always change the recipe. And none of these things increase breast cancer. In fact, there's plenty of evidence to the contrary. Our natural hormones, including testosterone, which is being studied to prevent breast cancer recurrences, protect us from so many things. I've told you about this, but many women in midlife get things like MS and start getting these weird rheumatoid things and joint problems, frozen shoulder, plantar fasciitis, dry eye. I mean, you name it, you start getting itchy skin waking you up at night. And it's all because you're starting to get inflamed because your hormones have declined.
My goodness. I was like, yes, you're reading my diary, like all of that. I was like, why are my lips peeling? What in the world is burning mouth syndrome? What is this dry eye situation? Why is everything dry? And yeah, so here's something that came up for me when you were just talking right now, because it made me think of how I used to think before I got myself educated. When you said compound pharmacy, whenever I used to think of compounds, I used to think, okay, fine, somebody went to college, they're a little pharmacist, and he's sitting here mixing something, and then I'm supposed to trust that they mixed the right amount and gave it to me. Can you talk about that? Because I actually heard another podcast with a very popular life coach in the online space, who literally, the guest that she had on there was talking about, oh, compounds are so horrible and you should never do that, and just talking down on this thing that I'm experiencing so much benefit from. And I'm like, what is she saying? I'm not even a doctor, and I know she's full of crap.
When your ticker like starts wavering like this and something doesn't sound right, you're probably right. But the first thing that I'll say about the self-proclaimed #1 menopause doctor is that that is practicing hypocrisy. And we all do it in medicine. But for example, I have no doubt that she has prescribed a medication to prevent preterm labor that was compounded. It was a compounded progesterone. So, and we use compounded progesterone for people who are allergic to peanut oil in menopause. Like we use compounded medications often, especially face cream, certain to take additives out of things. So doctors use this all the time. And they're absolutely safe. Now, could there be a situation in a pharmacy where one batch is slightly different from another? Yes. But did you know that generics only have to have 80% of consistent active ingredient in them? It can vary by 20%. So don't think that you're getting the most consistent thing just because you're getting it from CVS or Walgreens. There's variation in that too, variance. It's allowed by law. Thirdly, I'll say that we use a pharmacy to make our pellets, for example, that has the highest rating and strictest standards that you can possibly have, and even more strict than many FDA approved companies have. So it's quite stringent. And then we also partner with two local compounding pharmacies that we've been using for years. I get my progesterone from them. I get my face cream from them. I get my hair pill from them. I mean, I use them and I trust them, and they have periodic checks. We have meetings. I mean, it's a very, very vetted process. So I think that's another thing, to make sure that you have a provider that has partnered with the right people as well.
When a woman, for example, I chose the pellets
Mm-hmm.
because they were convenient.
Mm-hmm.
End of story. And even then I was scared. I'm like, oh my God, this is going to be in my body. And what if I get symptoms that I don't like and I can't take it out? Like I was like a big chicken, but I'm like, I love everything about it. Other than convenience, what would be reasons that women would choose patches over pellets or the other forms of hormone replacement that are out there?
There's a couple of different reasons. I also chose a pellet. My testosterone pellet has truly changed my life.
Oh, it's changed my life.
Yeah. My level was like 7 when I finally got it. So things are much better now. But I chose it like you for convenience. I'm not slapping on a gel twice a day. It's just not going to happen. Other people might not want to use gels or creams because they, not only for the convenience part, but they might be concerned about small children or animals and things like that, which there's ways to get around that. I also like the fact that I'm going to have, it's going to slowly absorb. I'm going to have a nice level, and then it's going to slowly absorb completely, and I get another pellet. For some of us, like I have an adhesive allergy, patches and estrogen, so I'm skipping over to estrogen now, would not be an option for me, period. So I would have to apply a daily gel. I also have eczema, and applying, an alcohol-based solution and things like that might not be an issue, might not be an option for people like that as well. Also, those things, the patches have better overall absorption, but a gel can vary day to day as well. So if your skin is nice and warm and exfoliated and you apply it after you get out of the shower, you're going to absorb it much better than if you're dry and cold. But I have patients too, like they just don't absorb patches, or we have to find, a specific type from whatever country that they can absorb. So it can be very variable in that regard too. But on the estrogen side, again, there's no FDA approved testosterone treatment for women right now. And Dr. Susan, my partner, has a really good YouTube video on all of this. But oh gosh, where was I going with that? Oh, for the estrogen side, at least the patches and the gel are covered by insurance. When I put that in quotes, because I never know what it's going to cost you. And then you brought up also a very good point about, insurance costs and deductibles and things like that. And it turns out to be, for myself included, I went to the GI doctor the other day, and for 15 minutes, I was billed, because of my deductible, $172. So, if you multiply that times 4 and think about, what you're getting, the time and all of these things and availability. And then also too, if you kind of divide things by 3 to 4 months, things aren't that expensive, like, okay, well, I'll just eat out less once a week, which is just good for my health. And I'll put that towards my health expenditures. So it's all doable.
It is doable. I want to I want to ask about the testing, how often you do testing when a patient comes in, because when you don't know, you don't know. Another big fear that I had was like, well, how do they know? How are they going to know, or like how this thing is working? Like it's every 12 weeks, and then how do we know? And that was like a big thing for me. And before I saw you for my very first appointment, which was so awesome because it was just an hour of you and I talking, just you learning about me. That was so amazing. And I remember saying to you, well, I feel like I want to tell you all these things, but I know, like I should just, and you were like, no, we have a whole hour. Tell me all the things. And so I came there because, like, for the past 4 years, one thing that I knew was happening in my blood work was my A1C was just kind of creeping up. And I was like, I don't want to be a diabetic. I've seen my mom suffer from all the consequences of diabetes, her children from a previous marriage who have died of complications of
Mhm.
diabetes. Like, I don't want this. And I feel like I'm doing all the things. And then like the way fat was deposited, like coming in my body was, I'd never had fat like this before. And all the other things that I already mentioned that I had when I came to you. What is the blood work? Because I thought it was very comprehensive. Um, I'd never had blood work like that before. Can you talk about that and how often you do that blood work once you are a patient?
Sure, absolutely. So, our initial blood work panel is quite extensive. We measure inflammation and insulin resistance multiple ways. And the reason for that is because really inflammation is the root cause of all disease, cancer, diabetes, joint pain, you name it. That's that inflammation. It's called age-flammation. Some people even say that is why we age. And if you look at aging, in the lens through the lens of a disease process, which it really is. If you look at how it occurs, then if we reduce our inflammation, then we can all get older in health and have a health span, not just a long lifespan. I think that's what we all really want. So for that reason, extensive panel of labs. I look at insulin resistance. Insulin is the boat that carries sugar where it needs to go, if you will. And if that boat can't get across, if you're resistant to receiving the sugar, multiple things happen. It is the jumping off point for diseases, but then you also don't feel well and you have brain fog and you're hungry. And then that starts with cortisol, and it's a vicious cycle. So many women, when they go through or start going through perimenopause, have elevations in their blood pressure, start getting increased cholesterol, start getting fat around their waistline, start getting brain fog, sleep disturbances, dryness in the vagina, the eyes, everywhere else, hair loss. I mean, I could go on about the symptoms. And they're like, what is going on? And it's slow. And so they don't, it's just like suddenly after like 2 years, they're just like, what has happened? Like, I haven't changed anything, but something's wrong. And they're 45 and their doctor says, oh, you're too young for menopause. Like, no, you're not. You're actually in perimenopause. So there's so many symptoms, even like starting to get bloating and like gas, indigestion, acid reflux. There's so many gut symptoms tied to this as well. I mean, estrogen and testosterone are on every tissue in the body, and progesterone is on many, many, many of them. So the labs is just a way for us to look at not only those hormones, but many of your other hormones. Your thyroid's a hormone, vitamin D is a hormone. I mean, you have all kinds of hormones, right? But we also look at some of the micronutrients. Something that's commonly overlooked is ferritin. Ferritin is a storage form of iron, and it is absolutely tied to fatigue, immune system, energy, brain fog, hair, skin, nails. We look at different in body composition as well. So that helps us determine another way of looking at insulin resistance and overall health. And we talk about muscle mass versus fat versus body water. And we follow that as opposed to a number on a scale, right? Because I could have a person that's 120 pounds, but they're 28% fat and have almost no muscle. And I might have a person who is same height, 140 something pounds, and their muscle mass is, like 100% of what it should be. You get my drift. So it's very important to look at body composition and not just the number on the scale.
I really enjoy that about your practice, that I hop on this scale that measures all these things, body fat, water, muscle, right? And all the other markers like the inflammation. I remember 2 years ago, my doctor going, whoa, your inflammation is through the roof. Let's get you tested for autoimmune diseases, lupus, rheumatoid arthritis. And then all those tests came back negative. And it was like, well, you don't have those things. You just have high inflammation. And I'm like, what? So I did not know all the things. So then, I bought supplements like the curcumin and the omega-3s and the Akkermansia, is that how we say it? All that stuff, all of that combined, A1C is coming down and the inflammation is coming down. And I used to have fatty liver 3 years ago, handled that on my own, but I was like, what? How do I have this? women don't know all of these little things. There's a saying that says, how do you boil a frog? You turn the temperature up slowly so it doesn't jump out of the pot.
Yeah.
And so I think that our health is like that. Like, how do you get diabetes? Well, every year your A1C goes up 0.1 and you're like, I'm getting old. And like I said a little bit ago, I'm not a doctor, but now I see all the women in my family, or I see older women when I'm out and about. And for example, I was watching a YouTube video of an artist that I used to love when I was younger. Her name was Lisa. And so when I saw Lisa performing on stage, I'm not even a doctor. And I was like, oh my God, menopause got her. Like, I'm like, oh my God, she's got the mental body. I don't even know what that is, but I knew this woman needs hormones. She's like, oh my God. And I was like, I just wanted to email her. Does that happen to you? I just look at women and I'm like, this doesn't run in your family. This is just menopause.
Oh my God. I also love Lisa and the Cult Jam, but no, I mean, and you do like, I know we've all seen it. Like we haven't seen somebody in like 3 or 5 years and all of a sudden you're like, wow, they just aged like 10 years. And you're right. Like, so, I mean, you want to talk about powerhouses of collagen. Let's just talk about the outside here. Estrogen, testosterone, and progesterone all are very, very, very important for collagen. So yes, our skin can age very, very rapidly, but guess where else collagen is found? Everywhere. It's found in your blood vessels. So if they stay flexible and pliable, we don't get strokes. It's found in your joints. It's found in your eyeballs. It's found in your muscles, your bone. Like it's literally your hair, your nails. It's found literally everywhere. So that is so super important. And so when our hormones in menopause, just at one point, they testosterone starts declining in your late 30s to early 40s, and it's kind of steady for most people. And then the progesterone starts taking dips, and then the estrogen starts taking big dips. But at one point, you're just vroom, and not only do you feel it, like a lot of times it's visible. So
absolutely. That's why I was like, oh my God, Lisa needs hormones. She needs a doctor. So like I literally saw it. I'm like, this can't be just her. Like, no. And other singers and stuff from the 80s and 90s that I've seen, I'm like, oh my God, menopause. Like I'm like, you need hormones, baby.
oh my
I
gosh.
just want to be an advocate for this. Why? Obviously, I heard you a little bit ago. You were like, well, these hormones we have all of our body, like then all of our life, and then we go into menopause, and then some man who's never gone through menopause and is not a woman, obviously, decides that they're going to pass a bill or something or some law that says, hey, it's not important for women to replace these hormones that they've had all their life. When you told me estrogen protects you from like heart attacks, actually, estrogen is so important in like dementia, and like talk about the importance of estrogen, the whole brain fog. Like I used to say to my daughter who's in her early 20s, I was like, Mama, I'm not depressed, but I don't know what else to call what I'm feeling, but I know it's not depression. But I just felt like blah. I felt like I didn't want to show up on social media for my business. My business is heavily on social media. Talk about estrogen and how important it is for longevity of women, our life.
So estrogen is highly, highly protective, especially when replaced earlier on. So ideally, while you're going through the transition, but even within the first 10 years, we know that it is protective of heart disease. There's several reasons for that. If you want to get sciencey on it, like we talked about collagen, it increases nitric oxide. Some of y'all may have heard about nitric oxide. It helps dilate blood vessels. When our blood vessels, if our pipes are open, right, then the nutrients and the oxygen can get to where it needs to go, right? So if they're narrow and clogged, what do you think is going to happen? Like that tissue is not going to get the nutrients that it needs, and it's going to die just like a plant would, And there's even more science behind that, but it is crucial for our bone health. It also, when we were talking about breast cancer, like very, very few women thank the Lord, are going to die in this country of breast cancer when it's caught early and treated. So we have done such a good job with that. What we die of is heart disease. Like that is what we die of. We die from complications of osteoporosis, and estrogen is huge, huge in preventing this if it's replaced.
And so you say within 10 years of menopause, this is
Mm-hmm.
still a very good thing. I was really going back to the blood test. When I met you, you were like, hey, this other test that's also not covered by insurance, but you may want to have it, the calcium score.
Mm-hmm.
And I was like, oh, I just had it last year and it said 0. Why do we want to check that calcium score?
So that's a great question. When we have clogged arteries or plaque, at some point they become calcified. There is calcium deposition in it, and it's hard, like mineralized, like kind of like bone, and that shows up on a CT scan as white. Or they can interpret if there is a plaque or clogging of the arteries and how much. The reason that's important, especially if you've been if you've been past menopause for a time and are considering estrogen for osteoporosis, or for still having hot flashes, or for whatever reason, general health, I'll often recommend that anyway at the age of 50, but I'll often recommend that as well because with estrogen being vasodilatory, there are some people who hypothesize that, gosh, if you already have plaque, could that make it break off and go to the brain and cause a stroke or something like that? But it's also just very, very good to know, because if you already have calcifications in your arteries, that's late. That means that the soft part of it, the squishy part that had been clogging, is already there in other places. So that means we
Mm.
really need to get a handle on everything, have you go to a cardiologist and do some more testing as well. Much of this is reversible, especially if it's soft plaque. We know that if we decrease inflammation, we can shrink plaques. Like we can go, that's a whole nother podcast, but the whole point of this is to catch these things and start treating them so that they're not problems. Like when you mentioned watching the hemoglobin A1C, I just, this is very a traditional medicine thing to do. We'll just watch that. You're borderline. No, man, it's gone up. It's gone up like, 5 years in a row. Like, this is a problem. Why are we going to wait until I have the disease? And all of the things that are going on too. It's slightly elevated A1C. Anything above 5.5 can have the same long-term effects, including amputations and fatty liver and all the other things, as someone who is a diabetic. So this is not something we want to wait on. And I encourage you guys to keep your labs like in an app or on an Excel spreadsheet, and look at your trend and be like, oh, although it's still normal, and we can talk about what that means, that the fact that it's going up, like you saw, Linda, that's a red flag. Absolutely. Do something about it.
Yes. And I just want to add here, because I know that this is something that you offer at your practice as well. Um, when I discovered the whole CGM, the continuous glucose monitor, at first, I want to say like the first 3 months of this, I really didn't even really get it. I was just like watching my sugar go up and down, not really understanding, oh, this particular food affects me this way. I made some protein pancakes. I thought, well, it's protein. Oh my God, my blood sugar shot up to 203. And I was like, I don't ever want those damn pancakes bad enough. I'm talking about never, because I said something a little earlier, where there isn't enough pain, there isn't change. I know that.
Mhm.
I know that because I
Mhm.
deal, with I'm a life coach, right? So like I deal with human behavior and people changing. But we live in a time where there's so many amazing tools for biohacking. For example,
Mhm.
this ring that I have tells me, oh, hey, Linda, good job. The past 7 days, your sleep score is trending up. You're getting more sleep. What I discovered with this, I'm not a drinker, but I'll have a drink occasionally. I'll have a skinny margarita if I'm out. Whenever I have a skinny margarita, my heart rate is elevated through the night.
Mhm.
I don't sleep as well. I do not have uninterrupted sleep. My blood sugar is higher in the morning. Like this ring and this thing together when I don't sleep well, my blood sugar trends higher in the morning. And so we have so many great tools that could help us in between doctor visits. And I know that you also offer a managed weight loss program. Talk a little bit about that, because I know some of these biohacking things are included in that.
Absolutely. So I love it when my patients get the continuous glucose monitors. I can't tell you, a processed food is a processed food. If we pulverize protein, if we pulverize wheat, if we pulverize sugar and make it to where it can be absorbed rapidly into the system, it can increase and will increase your glucose and therefore your insulin. And just because something is quote unquote sugar free doesn't mean that it still doesn't have a ton of carbohydrates in it. And carbohydrate is broken down to glucose to be utilized by the body. So I'll say that. Yeah, so one of the things that we offer our patients is nutrition consults, which I do. It's really wonderful to sit down and talk to the patients and figure out exactly what you're talking about. Alcohol, for example. You don't want breast cancer? Reduce your alcohol consumption. It's a class 1 carcinogen. It increases forms of almost every kind of cancer, depression, autoimmune disease. I could go on. It destroys your gut microbiome. It interrupts your sleep. It increases hot flashes, et cetera, et cetera. But so that's one of the things that we can do at a nutrition consult, but also in our weight optimization program. So we sit down, we do the full panel of labs. We go over what's going on in your life holistically, your spiritual health, your connections, your activity, your nutrition, your rest, because they all matter. They are all very important pieces of the puzzle. In addition to that, we decide what is right for you. And so we offer semaglutide, we offer tirzepatide. I don't offer it to everybody though. I look at some people's labs and I'm like, you're not insulin resistant. You don't have inflammation. You have, I think, this gut issue, and you have low thyroid. Oh my gosh, I diagnosed so much suboptimal thyroid and hypothyroid. I can't even tell you. And we can talk about that as well. But ladies, let me tell you, if your thyroid is low normal, it's not okay. But so basically it's a personalized, individualized medicine. And then we come up with a plan, and we have accountability. We have meetings, appointments every 2 weeks, and we do the InBody scan, and we adjust, and we look at protein and look at carbohydrate and activity and what else is going on in your life. So it's a really successful program. It's about 12 weeks. And then a lot of patients tend to go on to the monthly after that.
Let's talk. I'm going to go ahead and, because I want to be, I know we both have to start our work day. Talk a little bit about the thyroid, how important, how you diagnose under and overacting thyroid. Let's talk about that.
Okay, sure. So, and again, I want to empower you to go ahead and get your own labs if you need to, which you could do you can log on to Quest or LabCorp and actually order labs for yourself. You can go to any lab test now, or you can just ask your physician to order a free T3. That is the one that is often not measured, and TPO antibodies. So the traditional medicine way of doing things is often not to order the free T3. T3 and T4 are your thyroid hormones for the most part in your body, T3 being about 80% of what's utilized. It's often overlooked, and it's often, I see it go down, 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 down while women are going through the menopause transition. It causes brain fog, fatigue, low libido, dry skin, constipation, thinning hair, eye problems, again, skin conditions. I could go on, weight gain, so much more. And so sometimes all we need to do, in fact, 97% of Americans are deficient in iodine. So a lot of times we just need iodine, selenium, zinc, and maybe some ashwagandha as well. It is so important for you to be able to optimize your thyroid, and for iodine to actually be able to attach. If there is bromide and fluoride, stay away from fluoride in the tap water, toothpaste, and mouthwashes. It lodges in your thyroid instead of iodine, and you can't make hormone.
When you told me that, I was like, wow, you were like, Linda, even high blood pressure, like you can see blood pressure rise. And if you just get rid of some mouthwash, you might see a difference.
Yeah, the alcohol-based fluoride mouthwashes, I would just stay away. I use one, I think I get it from Whole Foods. It's called Natural Dentist. It's just aloe, mint, or just don't use mouthwash. I mean, whatever you want to do. But the alcohol is killing the good bacteria, which is causing its own host of problems, including insulin resistance, weight gain, high blood pressure, etc. But fluoride and bromide's like a chemical because of the floors and the paint and the cabinets and all those things too. But so that is something that you could do right now. But again, if you're T3, I want it to be around 3.2 to 3.5. That's kind of the range you want it. If you're down at 2.6, it's too low. Certainly down to 2.2, it for sure is. But a lot of doctors just aren't even measuring it. And so we're not getting the whole story, because you have to convert T4 to T3 in your body. And if you're not doing that well or enough, then you're going to have symptoms like I was saying, and it might not be overt if they're only checking a TSH and a T4. And it really needs to be a free T4, by the way, because if you're taking biotin and some other things, that can change the labs.
Oh, okay. Free T4.
Yeah, free T4 and free T3.
Thanks. Now, I'm going to end with this, because it seems like so many women who are in perimenopause or menopausal or postmenopausal, this A1C, it's almost like a staple symptom. Like, so many women experience it. And I know that this is my second round of pellets. So, I'm not expecting miracle results, but I do know that it's lowering not because of the estrogen and the testosterone is what's lowering it, because now I have the energy to get back in the gym. And so I sent you a video of another doctor that I follow, who she believes that muscle is the thing of longevity. Like, muscle is what makes us live longer with the quality of life. How do you feel about that? Do you agree that, hey, once these hormones are working, you got your energy, you should be wanting to build muscle, or not?
Absolutely. I agree with Dr. Lyons 100%. And I agree with your statement. It's, the hormone replacement's not a magic wand. You have to do your part, but part of that is like, you were so exhausted and not sleeping and all of those things. It was hard to go do those things, even though you wanted to. So don't get me wrong. The hormones will independently help with the insulin resistance, but then you going and actually lifting heavy things, I don't care if it's your own body weight. I don't care if it's, a suitcase like that you want to be able to lift into the overhead cabin. And that's actually a very good goal. Whatever it is that you want to practice doing for even 2 minutes a day, do something and lift heavy things. It's very, very important. Not only that, when we build muscle, we're going to just burn more calories just sitting there doing nothing. But it feels good to feel strong. Like, you're carrying 2 bags of groceries up the stairs and you're like not even out of breath. You're like, I'm bad. So, to quote the 80s.
Literally. For me, it was like, okay, this weekend, I took my friend's granddaughter shopping, and we went to the Galleria, First Colony, some other outdoor malls. And when I got home, I had like 12,000 steps, and I was not dying. Where before I'd have been like, oh my God, I need a foot rub in 3 days to get these hamstrings. Okay. Literally, it was just walking all day. And I was like, oh my God, I can walk all day. Get out of here. I'm going to Disney. Dr. Leah, I appreciate you so much for being here today. Is there anything that I didn't ask you? I know we talked about all the things from a consumer, from a patient perspective. What's something from a doctor perspective that we didn't cover and you're like, no, women need to know this, or this is one of the biggest mistakes I see women make as far as their health? Is there anything that you want to add that we didn't cover?
I would just say that if you know that something's not right, if something's wrong with you and you're being dismissed, come see me. But other than that, I mean, some just easy or obvious supplement-wise things to do, I would say, is eat the most nutritious food that you can. That's your best supplement, best high-quality food that you can. Fatty fish, sardines are a great thing for you to eat. I know half of you or most of you are like, what? That's where you're going to get, omegas, iodine, iron, vitamin D, all kinds of things. But if you were to start something supplement wise for your health, some magnesium is very beneficial for most people. And you can do 600 milligrams of magnesium glycinate or L-threonate at night. Not only will it help you sleep and relax, it is incredibly good for your heart, nervous system, your gut health, and so much more.
I just want to add that Neuromag has changed my life. I was like, oh my God. I was taking some other magnesium for sleep, but that Neuromag is like, oh my God. It's why my sleep score is trending, and I'm feeling like I'm such a badass with my health right now.
Glad to hear it.
You mentioned, hey, come see me. Where can people find you online? Are they going to get, are you going to order all that blood work for them? Like, where can they come see you? Because I know that you have your local office where I go for pellets, but people can also see you online. Yes.
Oh, absolutely. So we have, right now we have 2 offices, one in the Museum District on Benz and one in the Tanglewood area on Voss and San Felipe. But I also do virtual appointments. So does our new doctor, Dr. Hillary, and Dr. Susan is a little harder to see because she's working on a book and other things and working on our 3rd office in Cyprus. So the website is completemidlifewellnesscenter.com. And you can make appointments online. You can call, you can message us. So
the website is completemidlifewellnesscenter.com.
Correct.
Okay, I'll be putting it in the show notes and in the description of the video so you guys can make your appointment and go. Dr. Leah, thank you so much for taking the time out this morning, for being here with me today, for wanting to impart this knowledge. I know that I don't take it lightly, right? I'm like, I know you say this all the time, but you didn't say it to my viewers. You didn't say it to my clients. So, and I am here for the empowerment of women, not just the socioeconomic. I love for women to make a lot of money. I love for women to make money that's not attached to a man. I love for women to just be empowered. And if we are not in the body that we love, with the energy that we need, with all the things running properly, we just can't be our best selves. We can't be the best mom. We can't be the best friend. We can't be the best anything. So I appreciate you so much for being here this morning. Thank you so much again. You guys, the website is completemidlifewellnesscenter.com. And Dr. Leah, Dr. Susan, Dr. Hillary, and other, I know you have other nurse practitioners. Yeah, you have like a huge staff. Like you already told me in January, you're not going to see me. I'm like, what? No, you didn't say it like that. You guys are growing, and that's great. That's a great problem to have.
No, it's wonderful. And also too, there's other way to find menopause providers. It's the menopausesociety.com. So I didn't mean, come see me, but there are plenty of menopause providers out there, and continue to advocate for yourself. Okay, ladies. And thank you so much for helping us get the word out.
Wonderful. Have a good day, everyone.
Okay.
Talk to you soon.